that this is really a game changer. This is a technique that can restore the jaw bone and the teeth all in one day. That's what the innovation here is.
In order for our patients to be able to reconstruct their teeth so they can chew and eat and smile like the way they were able to before, would usually require multiple procedures. And this kind of innovative surgery allows us to capture all those aspects of reconstruction in one surgery.
It requires a knowledge of head and neck surgery, oral and maxillofacial surgery, dentistry, prosthodontics. And so there's just a lot of disciplines that are involved, and there's no way that one person could possibly do this surgery on their own.
I unfortunately practice in an area where there's a fantastic oral surgery team at Cedars Sinai, and I came to know Dr. Lee and Dr. Kupferman, and we started talking about getting this program built up.
There's certain parts of these procedures that are very delicate, and it requires a lot of trust amongst the doctors, because we're working in each other's territories, and we're working on very sort of delicate scenarios, and we have to have ultimate trust in each other's capabilities and competency. With the advent of technology, and in particular in healthcare biomedical engineering, we've really been able to combine techniques that have been around for a long time and really turn them into a composite procedure. The ability to take the fibula, one of the bones in the lower leg, to reconstruct a jaw has been around for a long time. To place dental implants has been around as well for a very long time. But combining those two with technology, 3D printing, biomedical engineering to make it precise and combine all that into one operation, we couldn't really do it without the knowledge base and the camaraderie.
We also make a model of the fibula. We're going from the right leg, and the implant will go on the anterior surface here. Eventually that'll be the piece of bone that's restoring the jawbone that's removed. I do think it's a rare commodity where you have oral surgeons that work as closely with head and neck surgeons. That particular combination doesn't come up that often. It's kind of like a perfect storm, where you have like-minded individuals that come together to get this done.
This surgery has, at least 1,000 steps, and every single step, there's a little detail that could probably, have a major impact on the patient. And really kind of knowing the nuances of every step has been critical, because the last thing we want to do is actually make this something that would harm the patient.
It's this adage in surgery, measure twice and cut once, but with virtual surgical planning, you can measure hundreds of times, just in order to make sure you're removing the perfect amount of bone, you're making sure your fibula bone is fitting perfectly to really enable ideal reconstructions.
Some of these patients have been dealing with this for years, if not decades, and a lot of that is because there's this great fear amongst patients and actually even other doctors that this operation is extremely high risk. There's going to be minimal benefit. Let's just get you on antibiotics for life, for long term. And I tell the patient, a dead bone is not going to become more alive. But for me, it's more of a quality of life issue where these patients just can't be on antibiotics for the rest of their life and then having pain either. When we're able to collaborate together, sometimes we're able to accomplish things for the patient or goals for the patient that were actually not feasible ahead of time.
For so long, people got their jawbone back, but it was not functional. They couldn't even speak well, they couldn't eat, they couldn't swallow, they couldn't smile, they couldn't kiss, they couldn't do all these things. And so when you kind of bring it all together, you really kind of see all of the components to the jaw and the function of the jaw. And when we can do that in one operation, you realize the real true value.
One of our index cases where we really saw that this is a powerful technology was a younger patient that had a congenital abnormality where she had a loss of sensation, but she didn't feel pain. She had fallen and developed a jaw fracture that had gone untreated. and as a result, she had lost most of her teeth of her jaw, and had a chronic infection that was draining fluid into the neck, actually. And I think she had seen multiple other hospitals, other specialists, and nobody wanted to really address this definitively. And she came to us as a third or fourth opinion. We talked to her and her family and decided that this is a more aggressive approach, but it really is the only way to get out of this jam. And she did great. Exited the hospital after about 10 days and had a full restoration once she got the prosthesis placed. And that was one of the cases where I really saw that this is a powerful technique.